Medical professionals of Reddit, have you ever had a patient so lacking in common sense you wondered how they made it this far? If so, what is your story? There is a reason the instructions for prescription suppositories say unwrap and insert and not just insert. Physical therapist, had a patient with neck pain and spasms, also complained of anxiety and heart palpitations. Asked about caffeine intake and patient revealed drinking an average on 15 to 20 cups of coffee daily. Had a buddy who was an EMT, he was called out to a location for a gunshot wound. Apparently what happened is a father was mowing his lawn when he accidentally touched part of the mower near the engine and burned his hand. He got mad at the lawnmower, pulled out his pistol, and shot it. The bullet ricocheted and hit his son in the leg. My brother shot himself with a ricochet hunting one morning before school. Dad had the doctor write that he was missing school and later PE due to gunshot wound to the leg, in his note. That note is now framed and hanging in the living room. He's oddly proud of it. No clue why. Gun safety is a huge deal to him. We weren't even allowed to aim Nerf guns at people or pets. Rural ER doc here. 35-year-old female walks in with right-sided jaw/neck swelling. I think it happened because I ate some meat yesterday that my body is reacting to 10 minutes later. Oh yeah, and I accidentally swallowed a bee and it stung me in my mouth right before this happened. Sorry, I forgot to mention that. A friend of my mother's died from a wasp that got into his drink. He swallowed it, it stung him on its way down, and despite having no allergy to stings, the swelling was enough to close off his airway. I'm a social worker and one of my clients literally kept getting pregnant over and over after having kids. And I had a frank conversation with her about birth control or getting her tubes tied because she kept going through horrific births only to get her kids taken away, and she actually said to me that she didn't know that birth control or safe sex would save her from getting pregnant. She didn't realize that sex equals pregnant because she was sexually abused as a child and her father told her that she could only get pregnant when she's in love, and she had never been in love, so she didn't understand why she kept getting pregnant. Sex was only pleasure for her, so she didn't realize that was what was having her get pregnant. Not me, but my wife who is a vet had a client who got mad at her because he didn't realize that once he neutered his dog that he wouldn't be able to breed it. Had an 18 or 19-year-old girl come in my ER with some complaint that required an X-ray. It's standard that we do a urine pregnancy test prior to imaging on any female of childbearing years. She insisted she'd never had sex and there was zero possibility of pregnancy. We did the test anyway and it resulted that she was pregnant. We did a blood pregnancy test to confirm the result, since she insisted she couldn't possibly be pregnant because she'd never had sex. That was positive too. We gave her a few minutes to herself to figure out what the hell happened, and when I returned to check on her a short time later she asked me if she could get pregnant even though her boyfriend didn't go all the way in. She 100% believed that long as his penis wasn't entirely in her it didn't count as sex. It took nearly a half hour of explaining reproduction to her for her to understand that whether it's halfway in or all the way in sperm travel. Had an adult male patient who needed a Foley catheter. His mother was in the room, and they both lived together in the backwoods of TN. I informed them both of the order for a catheter, how it works, and why it was needed. His mother stated, well, he's still a virgin and I'm not sure I'm comfortable with his virginity being taken in a hospital. Saw a chart once where a person came in for a burn to their eye. They told the DR they read online that warm milk in the eye can help with irritation and their eyes were irritated. So they boiled milk and then poured it in their eye. Burned it all. Once had a guy come into the emergency room because he snorted a random white powder found in a plastic bag left on a random bench in the middle of a sketchy park and started feeling suicidal. I was using meth for weight loss, have heard a few times actually. My sister told me a story of a woman with chronic blisters and lesions on her lips. They couldn't figure out what it was for weeks. It would heal and come back. Heal and come back. Turns out she would jam out on like 3 bags of salt and vinegar chip a day for weeks at a time until the sores hurt too bad to continue, then she'd go to the doctor. Had a patient come in for facial burns because he smoked while wearing his oxygen. Twice. In the same week. Not a medical professional, but I used to volunteer at a free medical clinic to take vitals and histories. A woman came in with pneumonia and wanted to know why her normal treatment of drinking half a bottle of Listerine and smoking a pack of cigarettes a day wasn't working. I asked why she thought smoking was good treatment for a lung infection, and she said, Indians used to purify the ground by burning all the weeds away before planting, so I'm smoking to purify my lungs. I left that one to the doctor. I don't know if cleaner in a hospital counts, but this one time I got to work early on a Saturday morning and we immediately received a request for help from the ER and got sent over by my boss. When I got there, the first thing I heard was yelling from this guy behind one of the curtains. He was shouting at the nurses, "Don't touch my penis." And I didn't use any drugs. Then I smelled iron in the air, and then I found out there was blood all over the hallway, handprints in blood against the wall. Almost the entire floor was covered in blood with actual puddles in some places. What happened? The guy pulled out his catheter, causing arterial bleeding, and decided to run away from the nurses who were trying to help him. It seems like he lived through that. I never seen that much blood before that day nor after. I'm in the ER. So many stories. The one that left me dumbfounded was a woman was brought in by her sister for pelvic cramps, amenorrhea for 3 months. Lo and behold, she's pregnant. Sister informs me that she sleeps with the Brazilian construction workers building the condo complex next door. I ask if they have any questions. The patient asked me if her baby would come out speaking Spanish. After a long pause, and her sister staring at the ceiling, I told her, no, because they speak Portuguese in Brazil. Patient seemed relieved and the sister hustled her out of the ER before I could discharge her. I worked for an OB/GYN who had a patient he prescribed vaginal suppositories for. When she complained of no improvement, she came back in for another exam. He found 7 foil-wrapped suppositories in her vagina. I worked EMS for years. It never ceased to amaze me the things people will do to themselves or others for fun. Confronted with these types, my first question was always, at what point did this seem like a good idea? The weirdest one I can remember was a guy that put his penis through a large metal nut. Once he got erect, he couldn't get it off. Diabetic patient with foot ulcers that kept being infected with a lot of different gut microbes. Turned out he used to put his foot in the toilet and scrub the open ulcers with the toilet brush.